All right, this week we're going to really get into the actual model and start breaking that model apart that we talked about in the last 2 weeks into the exact steps that you've got to go through. Chapter 4 really covers conducting the internal-external assessment. Heavy reading this week. I get it. I understand. A lot of detail. But again, think about this. Your internal-external assessment is setting the foundation. And from here, we're going to work our way up the pyramid, if you want to look at the model a little differently, to the point, to that tip of the spear of how we conduct our business every day that makes us a viable institution and allows us to succeed. But without this strong base and without understanding the underpinnings of our organization and understanding the internal and external environment, we'll never reach that point. So here is your base that you're building. It's going to take a tremendous amount of information from the inside of your organization, but you must validate it with outside data. You're going to hear me say this later on. Your opinion's great. Your opinion really doesn't matter much when you're getting to the internal-external assessment if you can't back it up with fact. Our learning objectives are really focusing on the following. Internal views and views from the outside environment are important. I said that already. That's your foundation. That's what you're basing this on. But most importantly, you need to go out and find detailed secondary data. You're going to have data within your organization that may make you look fantastic. Let's take, for example, you've grown surgical volume by 100 cases this year over last year. Fantastic. That's great. How much did the market grow? Because if your market grew by 2,000 cases and there's only 2 of you in the market, guess how much your competitor grew? They grew by 1,900 cases. You lost market share significantly. You've got to focus on secondary data to validate. Primary market research, important tool, critical tool. You need to know what's going on outside of your doors. You can't sit around and convince yourself that all is good within your 4 walls without getting out and looking at your market overall. So what are the elements of the assessment process? Remember the model that we talked about earlier weeks here. Step 1 is the assessment process in our strategic planning model. That is where we get a handle on and we start understanding the internal and external data. The environment, the competition, what does the market, i.e. the customers, our customers, and we have several. We have the community at large, the patients. We have our physicians. We have the payer community. We have the business community. The market is composed of multiple players. But I want to drive home the last point too, is what is the internal capability? We could decide we want to do open heart cases starting tomorrow and become an open heart hospital tomorrow when we have no cardiothoracic surgeon on our staff. We have no nurses trained. We have no cardiac ICU. We don't have equipment. We don't have the internal capability to start tomorrow. You've got to be brutally honest with yourself. The SWOT analysis method has been around for years. Interestingly enough, back when I was going through my marketing undergraduate degree and actually going through my graduate degree in hospital administration, we focused a lot on the SWOT analysis. We dabbled with the 4 forces of Porter that we'll talk about a little bit, and those forces that Porter talked about were really used to explain the airline industry and what it was going through in the 80s, if most of you guys can remember that, and the sweeping changes that occurred. And Porter's model really explained what had happened in that. A SWOT analysis really didn't. SWOT analyses tend to focus internally, tend to focus on how we feel about ourselves versus a fact. The traditional SWOT analysis lacks rigor. I have been in organizations where we utilize it, but we bring a lot of Porter's 4 forces into it to really look at hard data from the outside and integrate that into the SWOT analysis, where we focus on the S and W as our internal and the O's and T's as our external, and all must be validated by data. The generic SWOT process doesn't have near the rigor around it. It can be built. It can be adapted. When you look really at the alternative, you look at the 5-force model of Porter, and you look at, I was calling it 4 forces earlier, I'm sorry, but it is the 5-force model that you really got down to of Porter. And you've got that competitive rivalry. You know you've got direct competitors. You know the hospital next door or the hospital down the street is your competitor, or the insurance company or the medical clinic is your competitor. You've got a rivalry. So that's an obvious force that is going to change your market and is going to be part of your overall market assessment. But you've got buyers out there. You've got the threat of being substituted. Who thought a family practice physician that for years built the patient base in the traditional model would be completely upended by a clinic at CVS or at Walgreens? There's a threat of substitution out there, and you've got to be aware of that. Your suppliers have tremendous power over you. They can disrupt your entire process by either shutting off supply, by increasing cost, or by doing exclusive agreements with your competitor, or getting in too close with your physicians and driving you down a road you don't want to go on. And then you've always got the threat of new entry. You know, someone completely coming in and disrupting. These 5 forces. Take a step back, and if you do remember the airline industry, and if you really want to do some reading on your free time, you can go back and look at Porter's assessment of the airline industry. Fascinating, fascinating when you really think about what all happened within the airline industry as a whole, as deregulation occurred and it all kind of blew apart. There are very close analogies you could draw to our industry today in healthcare. But again, the 5-force model really starts to take in that overall picture and really gives you a clearer picture of what you're trying to accomplish when you're doing your internal and external assessment. There are elements you need to consider in conducting the internal and external analysis. Remember the highlighted red areas? This whole sheet is highlighted when you talk about it. It's the overall environment. It's the market. It's your customers. It's your competition. And again, I want to drive this point home. It's your internal capability. If you don't have it today, how do you get it? If you're looking at your internal and external analysis and you've got an opportunity and you're starting to lay the groundwork and lay this base foundation, you've got to be brutally honest and decide, can we really do that? Do we have that capability? At another point in this discussion, as we flow through the process, you're going to have the opportunity to say, how are we going to get that capability? How are we going to execute, and how does that deliver? But if you don't have internal capability, you're going to have to look down a different branch. Market share really is the tell-all, be-all of your growth. The example I gave earlier of, I'm happy I grew by 100 surgical procedures this year. Congratulations. Guess what? Your competitor grew by 1,900. You lost market share. So you can look at it different ways. You can select a category. What are the total admissions at my hospital versus the total admissions at my competitor next door, and what percent of admissions in the community went to each hospital this year versus last year versus 2 years ago versus 4 years ago? What is the trend on market share? You can do that by individual areas within the hospital, by OB, by cardiology, or you can even do it by a specific VRG. Say you've developed a spine surgery program and you want to go in and look at spinal fusions or cervical fusions. You can look and see what is your actual market share done. You can pick territories. I gave an example of a competition in Reno where they were distracted. We went into their key zip codes where their strong payer mix was and went directly to their base while they were distracted. So you can break apart and measure how you're moving market share in zip codes, in a grouping of zip codes, in a region. You can select a demographic. Are we moving population among women who tend to be the decision maker? Are we moving population among people over 70? Are we moving women under 30? Why would you care about that? If we're growing in the women under 30, we have the opportunity to grow in pediatrics. We have the opportunity to grow in OB. People with education. How do we market? How do we segment our marketing? How do we change our education that we put out there? Or, are you looking at new residents? Are you looking at individual insurance? You've got different ways to segment market share. No one is better than the other, and they all serve distinct purposes. As you develop your foundation and your internal and external assessment, you're going to look at a mix of these, and you're going to draw upon those because that's the data that you're using to validate your internal and external assessment. I went ahead and included this example of how you could then take those individual markets and think about what they are and then actually rank them. It's just a tool that you would use. You would sit here and say, how are we doing in general medicine in a current? Where do we want to be in the future? Are they important to us? Years ago, people would have told you, well, the general medicine guys, the primary care guys, they really don't admit. They're really not that important to us. We want to focus on our specialists and subspecialists. Well, the worm has turned, and you want to build a large primary care base because now you want to capture lives and have individuals utilize your services for primary care because now you can control the referrals to allied subspecialists who then use your facility. So again, while in the past they may not have been very important, they're vitally important today to control the downstream revenue. They're even more important in the future as we move to population health management and start looking at homes, medical homes, where people come to us and start relying on us and seeing us as their institution. And then you get into the side of being brutally honest. Brutally honest with yourself, and it hurts. It's going to hurt. If it doesn't hurt, you're not being honest enough because no one's perfect. No one's perfect and no one's hitting on all cylinders. There's always room to improve, but you've got to dig deep to find it. As you identify those major markets and needs, and from that previous, you would then take and segment your markets. So again, you're building that foundation of assessment saying, here's the markets that are important to me. From those, I can draw my focus in and identify where my top opportunities are. And now we start getting into some of the financial underpinnings of this. Does this make sense? I may have a great opportunity out there that No one else is providing. A physician comes to me and says, I've got a great procedure that I want to start doing at your hospital. No one's doing it, and we should capture this market. Run. I don't mean to joke, but run. Take a step back. Review first and foremost, why isn't anybody else doing this yet? It's that very rare opportunity where you're the first. And you're the first on a really great deal. So you want to go back and look, what is our actual potential revenue? What is our actual potential volume? And also, is there a real need in it? So you're really trying to say, here's our top opportunity, and here's why those are top opportunities for us as we're assessing the internal and external forces that impact us. Looking at your physician staff, again, your physicians drive your revenue. They drive the vitality of your hospital. So as you work through your physicians, you want to get down to that detailed level. These are examples of the data that you will build in order to complete your internal and external assessment. This is getting down to the ground level of data that you would grab and capture and say, here's why we created this, here's the data that backs it up. You've got to get granular. Granularity on your competitor profile, again, as you're gathering data. What are they doing? What is their strength? What is their weakness? And more importantly, get into the data and find out who the top physicians are for that competitor. Because you're going to then want to go out there and say, I want that general surgeon on my campus. How can I get them there, and how can I disrupt the flow of patients into my competitor? Because here is the target. This is one of their key entities that drive their success. Can I make an impact on that? Again, you're in a gathering stage of all your data. An example of an internal assessment as you look at, where are we utilizing? Are we growing in the outpatient? I wanted to highlight this one because this is very critical. A lot of people don't think about this. Is the age of your medical staff. If your medical staff is aging, odds are so is their patient base. So what are you doing to get out there to attract the younger families? What are you doing to build your future success? And what are you doing to ensure that you have a transition plan as your medical staff moves towards retirement? This can be controversial, especially now, given the the landslide economy wipeout that happened just a few years back. That physicians weren't excluded from that. If anything, a number of physicians I know overextended themselves in the real estate business, and they've now delayed their retirement. But sitting down with them and talking about where they're at and what age they're at and where their target for retirement is becomes very controversial, because even though you want to talk to them about recruiting a junior partner, if they don't feel the market's growing fast enough, you're going to dilute their income. So it's a balance that you've got to work on and you've got to build. But that has to go into your overall assessment. Again, you're building the foundation for your overall plan here, and you can never have too much data. You can fall into a paralysis of analysis and overanalyze the data, but gather all of your information and gather it from multiple sources, from outside and then also factual sources. What is my demographic population? Who am I serving? Who are my customers that are going to come to our hospital, and who are our potential customers? This is market segmentation. This is marketing 101 when you really get down to it. But I pull this down and show you, if this is the zip code that I'm working within, in the 1 mile and 5 mile radius of my site, and I see that within a 5 mile radius of the site, I've got 74% of the population is a high school graduate, only 16% is a college graduate. Do you think that's going to change the way I communicate? Do you think that's going to change how you design your programs and how you market? Do you think it's going to change the time of day you offer services? It could. You could be dealing with a segment of the population that is basically punching the clock from 7 to 3 or 8 to 5 and has less flexibility during the day. You could be dealing with dual income families that now you've got to find a way to expand your hours into the morning or into the evening or into the weekends when they have time. So every one of these, I could go through a myriad of details and talk about how they're going to impact your decisions. You must know your market. You must know your market inside and out, and external data. Let's look at opinions on quality and decision makers, and look at the Houston area. This was an example given in your book, but I actually wanted to circle and highlight the comparison between Memorial Hermann and the Methodist Health System. Two real systems. This is real data, and this is really how you would use it. If you looked at Memorial Hermann and you looked at their overall opinion, they're the leader in the total, almost 12%. Methodist is 7% behind them. But let's push out and see why that occurred. Methodist wasn't always in second place. If you look out to the 65 and plus, Methodist at one point in time was the hospital of choice. And their population has aged out. Whereas you see, Memorial Hermann was not the hospital of choice. As a matter of fact, they were ranked third among 65 and over. But they've done something and intervened, and you can see in that 45 to 64 and backwards, they are building a base of patients and building a reputation for today and the future. If I'm at the Methodist hospital system today, I'm saying, great, I'm second ranked on quality overall, when you talk about the decision maker. However, I've got one of the oldest segments of the population. My population is aging out. Granted, they are the high utilizers, but it's also a population that is moving on. I'm losing ground significantly in the 18 to 34. These are the young families getting started. I'm going to be very concerned about my OB business. I'm going to be extremely concerned about my pediatric business. OB leads to peds, leads to ongoing service to those families. It's a key driver. If I'm losing reputation among the young crowd, I have a problem building. I'm going to redirect and see what I can do to penetrate that segment. If all I looked at was the first column, I would say, I'm in second, I need to gain 4 points. How do I do that? But without the knowledge of seeing the spread out there, I cannot recognize where my problem was. Because we've got the data, we can recognize where the problem was, and part of our assessment can say, we're losing the younger population. Now, from my experience, I would then go geographically and see if there was any geographic issues that occurred with that and drove that, maybe potentially as people moved out to the fringes of the community, and what's driving this issue. So that's also part of that overall internal assessment. There's different ways to gather that. You move to alternative research methods. If you really look at the different ways to find out, why did I lose that segment? Why am I no longer perceived as quality among the youth that today aren't utilizing the facility tremendous amount, but they are going to drive my OB and my pediatric volume, and they will bring the lasting market share over years. How do I find out? Well, I can do personal interviews. They're expensive. And while they may be flexible, you get a lot of bias. There's a high likelihood of trust that someone's going to have when you're interviewing them one-on-one, and how are you going to use my data? So you've got mail, internet surveys, that somewhat takes care of the bias, and they're anonymous. But again, that doesn't give you a lot of flexibility. Focus groups, they're not as expensive. If you've got a trained monitor, you can be very flexible, and you can probe questions, and you can go and find those nuggets of information, and people tend to be more open and honest because it's a group data that's going to you versus that one-on-one interview. So there's just all kinds of different market research methods you can get to garner that, and that's where I would go if I use the example before. Again, building that internal and external assessment. As we wrap up Chapter 4, I'd probably tell you, again, a lot of data in there, a lot of great examples of how people were assessing themselves and different tools that are out there. But if I had to drive home some points on your foundation, this is the foundation. Brutal honesty is essential. As you're doing that internal and external assessment, if you are not honest with yourself, you are setting your foundation on very weak footing, and it's going to crumble. Data has to back up the assessment. I said it before, your opinion's great. You are biased. And the sooner you recognize that when you're building your overall strategic plan, the sooner you get real and you are honest with yourself. Are you gaining or losing market share? Volume growth is great. Volume growth helps all kinds of things as far as spreading our fixed cost. I'm sure you guys have gone through hospital finance already, or if you haven't, you'll figure out real fast. Hospitals are very fixed-based animals, and we stretch our margins by getting into that variable cost and lowering what our production is. Volume cures all ills. But are you gaining volume as fast as your neighbor? What's your competitive advantage today? What's it tomorrow? And then let's go back to Porter's 5 forces. Let's talk about who can put up roadblocks for me tomorrow. My competitors can. My suppliers can in multiple different ways. The buyers. And it's not just the insurance company. It's businesses. Look at where the Leapfrog initiative came out of. It was a conglomeration of businesses up in Minnesota that got together and said, we're going to change healthcare because we think we can make it more efficient, more effective, and ultimately save cost because we're improving quality. And you got new entrants. This is your foundation. This is step 1. Step 2, you've assessed your market, you've assessed what's going on, you've got an idea of what your strengths are inside, who is out there that can impact you, and now you're going to get into creating your mission, vision, and critical success factors. So now we're starting to narrow our focus. Again, we've got the linear model in our book, but I'll talk to you as a pyramid. We've built that base and foundation, and we're moving to the next level of the pyramid. What happens as you move up a pyramid? It becomes more focused, and it becomes tighter, and the sides start coming in again until you reach that tip of the spear, which is your execution. Our learning objectives need to understand the vision and mission statements are critical, but they're different. I think I've said that each of these 3 weeks. Based on data. There's that magic word again. Data. Your opinion's great. It doesn't matter. Visions are created through these strategic conversations. You start talking about where data is driving. You start talking about the fact that we've lost the young segment of the population. How do we get there, and how do we become the organization that they want to be a part of? but really breaking it down to simplifying it. Mission statements are about what the profession is doing today. Vision statements are about what we dream about doing tomorrow. What are we doing today? What is our dream? So here we are at step 2. We've built our foundation. We understand our external and internal data. Now we're going to set our mission, vision, and our critical success factors. Why the critical success factors? If we don't identify what it takes to be a success, how do we know we're successful? Ultimately, all of this has to be written. All of this has to be documented and tracked, or you never know you're a success. How exciting would it be to watch the NBA Finals if there was no scoreboard and no one kept score? They just played. They played for a half hour, and at the end, someone said, well, you won. How do you know? You don't. We keep score for a reason. How do we know we are successful? We identify those factors and we keep score. This talks about your mission and vision creation and who impacts it. You've got that external business community. You've got your physicians, the government, your contributors, your community leaders, your patients, public service agencies, physicians, employees. I circled 2 of those. But I'll ask you the question. Is any one of them more important than the other? Really not. If you can sit down and argue the business community impacts my mission and vision more, I'm going to ask you, well, what about the physicians? What about the federal government? Oh, this thing called the Affordable Care Act. Oh, there's this thing called Medicaid expansion. But what happens if I've got contributors out there who want to see my organization go in a certain way, and these are people who have contributed millions of dollars to our hospital or to our institution and have the capability, capacity, and desire to contribute millions more? If I'm a public hospital, my community leaders are going to have a tremendous amount of influence on where I go and what I do. My patients, public service agencies regulate me. My referring physicians. No one of these are more important. That's part of what's fun about running a hospital and running a healthcare institution is there are so many constituencies that you work with, and they all interrelate, that the job is very dynamic. Well, so is the creation of your mission and vision. It's got to be dynamic. If it's static, you go nowhere. So before you actually begin that formal process, you've got to go through some questions. Because we've already laid our foundation, we've collected our data, we know what's happening internally and externally, but let's think about what business we're really in. And what's the likely future of that external environment? We've got all the data behind it. We know what businesses we're good at because we extrapolated all the data. We saw what was profitable for us. We saw what wasn't profitable for us. We saw what the community need was. And where is that going to go? And what are our competitors going to do? What are all those forces out there going to do? What's our most important product service? How have we changed in the past 5 years? I can guarantee you, if you're brutally honest, there were changes you went through in the last 5 years that you never anticipated. It's a great learning experience because as you're making your plan going forward, you've got to realize you're not going to think of everything. And you've got to make sure that as you build your mission and your vision, you've got flexibility in there too to adapt Because if you look back at the rapidity of change the last 5 years, it's going to be half the pace the next 5 years. To understand the difference between the mission and the vision, it's actually pretty simple.
There goes that term.
Our mission is what we do today. It's not what we wish.
Where are we at?
And what we're
what's the dream of the organization?
Where do we want to take it? Our vision is that detailed statement of where we intend to go. Honest and precise is another term for what? Brutally honest. It's honest, it's precise, and we clearly define where we intend to go in the future. Do we want to be narrow or broad? We talked about this, I believe, last week when we talked about what our focus is. Are we broad thinkers or are we a narrow strategy? Do we build a clinic here or do we build a system of clinics? Do we focus on just acute care or do we add post-acute services in home care, or do we add services for physicians? Narrow and broad thinking's got to be there. A mission statement is not solving world peace. You can't do that. A mission statement reflects what we do, actually, what we accomplish. When you get to the vision, your decision-making conversation around that vision is probably the most single important discussion that you're going to have with your board. And it's going to be difficult because, again, you're doing a lot of prognosticating and you're actually dealing in the philosophical world of what do we want to be when we grow up? Not what are we doing today, what do we want to be when we grow up? Where does this organization want to go? Everybody's got an opinion. What can we carry out under the umbrella of our vision statement, and what strategies or ideas would we not explore? In other words, are we too narrow, too broad, or just right? And then we come back to, do we have the capability? Do we have the capability today? Well, in the vision statement, it may not make as much difference on whether we have it today, but it's definitely going to set our task on how we build that capability for the future. A vision with problems. We're an area leader in quality health care. All right, we're back to world peace again. We're back to world peace. It's not specific. Doesn't define your area. Doesn't define quality. There's no definition. Vision with problems. World-class health care. This is a dissonance in internal capability, because guess what? That's an actual statement from a rural hospital. A rural hospital in the middle of nowhere, without research, without all this other, how are you going to be world-class health? You've got to be honest with yourself, and you've got to assess what your own capability is. A better vision is, we're going to be a not-provider. We will continue to be a not-for-profit provider committed to meeting the needs of our community. How are we going to do that? Step, step, step. We're going to accomplish this by 2020. It's time sensitive. And we're going to measure our quality defined by X. It's a better vision. It's globally saying where we're going, puts a time frame out there, and then actually defines how we know we got there. They all fit together. You've got your mission. What are we doing now? You've got your vision. What do we want to be when we grow up? And then your critical success factors. How do we accomplish this? It all goes back to our whole discussion. I told you the first 2 weeks, we're building foundations here. You've got your strategic plan, your mission, your vision, your critical success factors, and from that, you build that short-term business plan. It's our market plan, it's our operations, it's our execution, and you build the long-term focus and strategic plan goals. This is what we are building towards, and these are the steps in the process.
heavy material this week. I get it. Hopefully, I'm doing a good job of explaining it to you guys. I think I've gone through it and giving you some examples. I didn't want to talk too much on examples because there was so much to cover. Look forward to seeing your post online, and if you've got any thoughts or suggestions, feel free to email me. And I'm really enjoying working with you. Thank you very much.